really difficult time for many in the public that we work with on a regular basis. All that being said, I do hope that you all have a chance to rest and relax and enjoy some of the theoretically slower time that happens during the summer. Big news for the Alliance. We are thrilled to announce that we are officially moving forward with a name change. We are moved from the Alliance for Disease Prevention and Response to the Alliance for the Public's Health. You can see our new logo there, and you'll be seeing it in more materials that go out. The idea really was to make sure that as we think about our current mission, and we've moved from being reactive to COVID and begin to learn the lessons that COVID taught us and look forward to creating a public health infrastructure that works, the Alliance for the Public's Health makes much more sense as a way to bring us all together in a common theme and focusing on the issues that we know are so important. Finally, we hope to see you all in Minneapolis in October. If you are, if not for no other reason, then it'll be cooler there than it is going to be here in DC for the next couple of days. So if you think fall in Minneapolis, it'll be another really engaging and exciting meeting. Some quick staff updates. Sadie Gray has joined us as the Alliance Summer Intern. Sadie is a rising senior AU in DC studying public health and has been a great addition to our team so far. And unfortunately, we need to say goodbye to Abby. Abby's been our public health law fellow for the last 6 months, and we're sad to see her go. We're looking forward to see what she does next. So let's talk a little bit about what we're going to do today. As I said, we're talking about lessons from building movements for health and equity, and I want to introduce the 3 leaders from movements who've been focusing on improving health and equity, who are joining us today and are going to provide some of the reflections and lessons from their work, as well as answer your questions. Our moderator today is Tanae Hamilton Franklin. She's been involved in movement building on health equity and vaccination. She's Executive Director, Southeastern Health Leads, Executive Director, Southeast at Health Leads, overseeing program design, development, and operations. And next, it is my pleasure to introduce somebody who I have considered a mentor for all of my time in DC. He was one of the first people I met many years ago when I was working on the Hill, and has been really my joy and pleasure to work with him over the time. I'd like to introduce Matt Myers. He's the former president and founder of the Campaign for Tobacco-Free Kids. He's a longtime leader in tobacco control and has really made a difference in improving all of our lives by addressing all the issues that we know tobacco brings in our daily lives. And if you want to think about the difference, think about the restaurants that you were in 20 years ago and the restaurants that you're in today and how different they are. Sorry, having just spent some time in a country where that's not necessarily true, you really should really appreciate that more. And in our final speaker is Alice Chen, Dr. Alice Chen, who's the former senior advisor of Made to Save, Civic Nation, and executive director of Doctors for America. Alice is a board certified internal medicine doctor and a national leader in physician advocacy, community organizing, and public health, and was actively involved in creating Made to Save, which was a national COVID-19 vaccine outreach and equity campaign. I'll now hand things over to Tanae so you can hear from all of our leaders and get involved in the conversation. And again, thank you all for being here today.
Good. Thank you, Susan. Good afternoon, everyone, and good morning to those on the West Coast. I'd like to start by saying thank you to Angela and team for helping to organize our conversation today, Lessons from Building Movements for Health and Equity. So I had a chance to sit down with Alice and Matt a few days ago, and I'm really looking forward to our conversation, continuing our conversation. So we're just going to jump right in. So guess what, everyone? We are in a very polarizing political climate right now when it comes to everything that we want to do with regards to health and equity and public health. So I'm going to start off by asking Alice and Matt to talk to us a little bit about the lessons that they've learned in their careers, sort of keeping in mind the backdrop of where we are right now in 2024. So Alice, I'm going to start with you first. I'm wondering if you can share, just take maybe about 5 minutes to share a few stories that you've learned that will help us understand takeaways from movement building with regards to health and equity.
Sure. Thanks so much for having me. It's so great to be here. It's so great to thumb through who's here and see there are names I don't know and a lot of names I do know. So hi everybody that we haven't talked in a while. So um so the lessons that I've learned in organizing and campaign building and creating change are from my two organizations, from Doctors for America and from Made to Save. So I'll share a little bit of a snippet on each of those. Doctors for America was started in 2009, and it was the year when the presidential campaign was all about policy. That year was about healthcare reform. And a bunch of us had signed on to an open letter supporting the Obama health plan. And for me personally, it was the first time I'd ever signed something, Alice Chen MD, that was not a prescription. It was not a patient note. It had nothing to do with clinical care. But I was so frustrated with the healthcare system that I knew I had to do something. So I spoke up on this letter. And so did so many of my colleagues around the country who similarly largely had no background in advocacy and policymaking and understanding how the Hill works. None of that. What we knew was that things were not working for our patients. Too many of them were dying and suffering because they couldn't get access to care. And so we ended up mobilizing it ended up being about 15,000 doctors in all 50 states, doctors, medical students. And we sort of dove headfirst into the fight that became the passage of the Affordable Care Act. And so many of us were worried about speaking up because we weren't necessarily experts on all of the policy issues, because we didn't necessarily know, how does Congress pay for healthcare reform? I don't know. I don't know how Congress pays for anything. But what we learned was that was not our job. Our job was to share the stories of real live people that we took care of who were suffering because the healthcare system needed to change, and to explain what was wrong, what was broken, and what needed to change. And that created kind of a safe space for doctors and medical students to be able to speak up and to partner with local organizations, state organizations, national organizations that were all working on healthcare reform. And maybe they had the lobbyists who understood what this senator needed to know and what that member of Congress needed to know. And we partnered with them to get our voices out in op-eds and letters to the editor, and we're able to, through that partnership of real stories, what's happening on the ground, and working with folks who are sort of more in the political campaign space, to make the doctor's voice known that we wanted healthcare reform to happen. Janae, you gave me 2 minutes, but I already took 2 minutes on the first. Can I take another minute?
Yeah, take a couple more. Yes.
All right.
I upped it to 5, so go
All
ahead.
right. So, Made to Save, on the other hand, was a really like a coalition effort. So we, at the beginning of COVID vaccine rollout, we all saw that people were not taking up the vaccine in the ways that we thought they would. It was, it started out with healthcare workers, and it was mainly the sort of the lower income people of color among those healthcare workers who were like, I'm not sure about this vaccine. I don't know if it's safe for me, even though they were seeing people who were dying of COVID. And we realized that we needed to have a concerted campaign to reach people who had many, many, many reasons not to trust the healthcare system, not to trust public health, not to trust the vaccine. And what we did was we pulled together a coalition of the everybody's, so federal government, states, national organizations, businesses, education, local organization, everybody. But at our core, we had 110 community-based organizations that we provided grants to and provided wraparound support to. We chose organizations that were not necessarily out there talking about vaccines all day long. We chose organizations that were rooted in their communities, that had known trust in those communities. They had relationships in the communities, and they had a proven track record of reaching people in those communities. And we help them understand, what is the vaccine? How do you talk about vaccines? How do you help people how do you understand what people's fears and worries and concerns and their, access issues are? And we allowed the trusted people who are in those communities to go out there and talk to people in their communities about the vaccine. And we ended up having millions of conversations with people, 21 plus different languages. And these little community organizations were able to mobilize like 200 people to show up at a CVS and get their vaccines. And they ran out of vaccines. They had to come back the next day. They organized so many different ways that they reached people in ways that were so core and so reflective of the character of that and the culture of that community. And they were wildly more successful than I think a lot of people thought. And then, many of the multi-million-dollar advertising campaigns, what reached people was neighbor to neighbor, person to person conversation. It's my snippet.
Yeah, so let me ask about the Made to Save the Coalition. How is that a movement? So how do you, because you brought folks together, but I've always heard the term, what's the difference between a movement and a moment, which is sacrifice. So can you talk about the sacrifice that the organizations made, that the partners made with regard, particularly in this very polarizing political climate? How would you sort of describe that movement?
I mean, people went all out to reach their neighbors, right? People were in the hot sun in Texas on the border, knocking on doors, going to the colonias that didn't belong to a public health department. Nobody was coming out to talk to them. And these organizations, they drove over and they like knocked on doors and talked to people and had long conversation. It wasn't a like, you want the vaccine or no, okay, bye. No, it was a real conversation with people, understanding who they were and having that conversation. There was a woman who was the organization was serving the Vietnamese community. And she started out just getting her elders signed up for the vaccine appointments, and then ended up being hired by this organization based on the grant that we gave them. The posters that they had, their website on the vaccine, the phone number on there was her personal cell phone number. She put her personal cell phone number on there so people could call her 24/7. Her 3 kids and her husband were like, "What's going on? Another phone call for mom." She was so committed and dedicated to her community that's what she put into it. I think the other piece in terms of like, I wouldn't really say it was a sacrifice, but it was all in, and we strove to create a space where everybody could feel safe, that anybody could speak up about what was working, what was not working, what were the resources they had, what were the resources they didn't have. We created a space where people could celebrate their successes, big and small, whether they were a teeny tiny organization somewhere or a big national organization. Everybody had a seat at the table, everybody had a voice, and we really tried to cultivate it so that the community felt like it was at the center, that there was that people didn't have to, they didn't have to change the way they spoke. They didn't necessarily, if English wasn't their first language, that was okay. They just said what they had to say. And their passion came through, and they knew that it was safe for them to be who they are, because our mission was all one thing, even though everybody had their own organizational missions, their long-term strategies. But we knew that we all had to do one thing together, which was get people vaccinated. And then we tried to set up the campaign in a way that organizations that were a part of it got something out of it that they could take into the long term. They got relationships, they got understanding, they got information. The community organizations got training in digital ads or doing radio ads or whatever it was that they needed in order to both do this campaign and also move forward on all of the health justice and all the equity issues that they are working on.
Thank you. Thank you, Alice. I was just noticed in the chat that Scott mentioned that there is also an editorial that was published in the Journal of Health Communication. And yeah, so it sounds like there's a lot of joy in this movement, in this work that was done. Let's pivot to Matt. Matt, what can you tell us about the work that you've done, some of the lessons that you've learned with regards to tobacco-free kids?
Sure. I mean, before I do that, I say the key to a movement is to have 100,000 analysis. And if you have 100,000 analysis, you're well on your way there. But when I look at it, and I look at where you are for the Alliance, and somewhat where we were with tobacco about 30 years ago, there are remarkable similarities. And I think the key, there's some lessons to be learned in both. I'd worked on tobacco for 15 years before the Campaign for Tobacco-Free Kids was formed. We'd worked in coalitions. That's where I first met Susan, with a coalition on smoking or health that began for the first time to recognize that tobacco was a public health issue, but its solutions were really political. And that what we needed to do was build a political movement, and we needed to understand how political decisions are made. And therefore, we needed a little bit to get out of our own comfort zones in what we were doing with it. And so, in a critical way, the Campaign for Tobacco-Free Kids was born out of a level of frustration at how slow the pace had been, how little we had succeeded in creating a sense of urgency in public officials for a need for really meaningful action, and how the consequences at the time were really quite extraordinary. In the early 1990s, literally 30 years after the Surgeon General's report, smoking rates among high school kids were 36%. That's unbelievable. That as a result of the marketing of the industry and pricing of the industry in the previous 5 years, so we had lost much of the progress we had made in the previous 20 years with regard to it. And it was a come to a moment where we had to say, what do we have to do differently? And I think that's really important to understand here, because I think core public health beliefs, structures are being attacked in the United States today in a way that we haven't seen in any of our adult lifetimes. And what do I think we need to do is ask ourselves the same questions we asked in tobacco then, which is, what will it take to reverse that trend? How do we have to be physically organized? What is the message or messages that will galvanize our already existing supporters, but equally as important, make the need for action apparent and understandable to people who don't currently support us? How do we do it in a highly partisan way with regard to that? How do we take advantage of the crisis, in other words? And I think, it comes down to, when we were thinking about the creation of the Campaign for Tobacco-Free Kids, we talked about issues of structure. How do you come up with a structure that can be both decisive, quick, and inclusive? We thought about message. Our message hadn't been working. So what did we need to do? We needed to go down and we needed to do what everybody else does. We needed to study messaging. We needed to figure out what it is about our message that would motivate people to act. And then we needed to really hone that message and bring message discipline to it. We needed to figure out how would we reach a broader set of audiences. Now, in our case, we were fortunate enough that with a grant from the Robert Wood Johnson, for the very first time, we initiated paid media advertising. But the amount we spent was a drop in the bucket compared to the amount of attention that the advertising got. So what we needed was to have real professional discipline in not only what our message was, but where we communicated and how we communicated, so that it would, before the time where things went viral, would go viral. We needed to be sure that we figured out how we communicated that message to people whose impact we were trying to motivate. So for example, we ran a series of ads, a very small series of ads, with a picture of a member of Congress that basically said, whose side are they on? We didn't accuse them of anything or anything else. We ran one weekend in a senator's home district in a small newspaper, didn't spend a lot of money. And he called me at 8 o'clock on Monday morning just to tell me we had not gotten his attention. But you need that kind of discipline. And then we asked ourselves the question of, how do we create the echo? Politicians fail to act because they don't sense urgency, even when they're not being lobbied on the wrong side, but they certainly when they're being lobbied on the wrong side. And so we asked ourselves the question of, what would it take to demonstrate to them that doing the right thing was the politically smart thing? Sometimes it was polling that we showed them privately. Frankly, sometimes it was an ad that we showed them privately and say, we have two choices of ads we're going to run. One where we thank you for doing X or Y, and the other is where we wonder why it is you're doing something that will benefit the tobacco companies. And then we figured out both what policy actions would have the greatest impact, but what messages would motivate people to act. Because one of the things that I think we learned is that the most important thing is to motivate politicians to act. to give them a reason for acting, to give them language that shows that they're really comfortable saying, this is why I'm taking an action. The public pays a lot less attention to the very specific action. So for example, you know, our organization was the Campaign for Tobacco-Free Kids. Who could be against kids? It sounds like a no-brainer, but you know, the reality is in the first 20 years of tobacco control in this country, the tobacco industry owned the kids' message. And they used it to propose solutions that were kid-focused that didn't work. What the key and change in the 1990s was to take that message that we knew resonated and transform it. David Kessler deserves a lot of credit. In 1994, he gave a speech at Columbia where he said, every time you're seeing your mother or father die of lung cancer, you're looking at the last chapter of a book that began as a child. And that's how you have to look at it. Every mother and father needs to be thinking that their kid is the next victim of the tobacco industry's marketing. And that's where the focus needs to be. And when you got to focus on, when we were able to hone that focus, to be perfectly honest, people paid a lot less attention to the specific solutions. So what we were able to do was use the message to build the motivation for action. And then by studying the actions that made the biggest difference, we were able to propose actions that weren't really kid-focused at all, to be perfectly honest with you. They were focused on transforming societal norms and impacting broad ranges of behavior. And in public health, we do that very badly. We talk in terms that people don't understand. What does public health even mean? How does it affect me in my daily basis? If I'm a mom and dad and care about my kid, what action is it you're going to do that's going to change my life? We need to figure out how you get under their skin with regard to it. And we so often use language that resonates among us and among nobody else. And it's become more and more important because ever since Ronald Reagan, you know, during his inaugural speech said, government's the problem, individuals are the solution. The concept that we're all islands, as opposed to we're all fundamentally interconnected, has become one party's platform. And what we have to do in real ways that don't sound partisan is talk about people about how do our actions affect you on an every single day basis. And I think here too, kids are a great one. You know, Flint, Michigan should have been the perfect opportunity. Decisions that get made about water are fundamentally public health decisions, right? They're the perfect example of something that impacts an entire community. And not surprisingly, a community that is our poorest community has the smallest, the voice that least gets listened to. We need to take all of those things and ask ourselves, what will get under the skin of the most people and motivate them?
So
and it's
Matt,
not our
yeah.
traditional public health message.
So one of the things that I was sort of noodling on when I heard about tobacco-free messaging, I heard it from our state health department, who at that time was a supermajority Republican. But I also heard the same message from the local NAACP chapters across the country. So my question to you is, with different stakeholders, different organizations that have different goals, how do you, before you even get to the messaging, to executing, what are some of the things that you all did to build trust amongst the stakeholders? And just for the audience, just to let the audience know, in about 11 minutes, we are going to open it up because we do want to have a dialogue with the audience.
I think that's a great question. It's communication. It's building relationships, long-term relationships, not short-term relationships. It is building trust. It is building understanding in order so that everybody sees in it both what's in it for them and how by being together, they are part of something much, much stronger. And I think that's really true. And in tobacco as in public health, it requires education, a lot of education to work on that. So for example, the issue of smoke-free. We now have data that shows smoke-free air laws impact everybody. But there's actually a disproportionate impact among low-income workers because they're otherwise the least protected and most exposed. When we were working on, Susan mentioned smoke-free, tobacco-free restaurants. We spent a lot of time working with people who worked in those restaurants. Waiters, waitresses, bartenders, even singers in nightclubs. They all suffered from tobacco-related diseases at far higher levels. And when the industry talked about increased costs, we talked about the fact that no one should have to put their life in jeopardy in order to be able to feed their children. But it was reducing the message precisely down to that so that people would understand it, that this wasn't some big, bunch of wealthy people who just like to eat in fancy restaurants. This was people had to literally put their life at risk in order to earn a living, and that was wrong. Flight attendants also articulated it very, very clearly back when that whole issue of flying on airplanes. Flight attendants were dying from lung cancer and other tobacco-related diseases at much higher levels. So knowledge, relationships, clear communication, and then clear understanding of strategy and development. The other piece that I think is important to that is not all of us need to be doing the same thing. And that's really important, is to recognize that different individuals and different organizations have different strengths and different reaches. And the smart strategy will be to figure out how you take advantage of all of them to create something that's greater than any of them individually. And that requires a strategist overlooking it. It also requires that you don't spend 6 years in a coalition meeting debating it. You've got to find ways to make smart, quick, and thoughtful decisions, even while listening carefully and being inclusive.
Matt, hold on to that thought because I'm going to come back to you in a moment. But Alice, I want to come to you right now. And what I'm thinking about is sort of, before you even make decisions, everyone sort of needs to have consensus. So when folks are coming to the table from their own organizations with their own priorities, what are some opportunities or what are some lessons that you've learned in terms of how to build consensus on a group, even though we all want to cook the same meal, but we might have different recipes. So talk to us about consensus making in your experience.
I think it's more that we're all hungry. We need to eat something. And one person wants spaghetti and one person wants pizza and somebody wants salad. And then you can't actually make all those things. You have to just commit to something. And then, I guess I can eat that. So there's a little bit of that. I organized doctors for a long time. Like, nobody agrees about anything, right? Everyone has their own ideas. Everybody has their own campaign they want to do. They don't have enough time to do it. They're hoping other people will jump on board. And so I think part of it, it's not necessarily like you take a group like the Alliance, there's no way you can have like a sentence, a message that everybody wants to do, one campaign, one policy that everybody wants to sort of put a ton of time into, right? So you kind of have to do like, what's going to get the greatest number of people excited to work on something, and go with that. And sometimes people come on board. We had this hilarious experience in Doctors for America in 2012. We wanted to shout from the rooftops how important the Affordable Care Act was, and we shouldn't elect people who are going to repeal it. And so we're doing this kind of education campaign, million people education campaign. We're trying to get doctors to go out there and educate a million people. And people are kind of some people were really excited, some people were really not. We came up with this harebrained idea that we were going to drive a bus from the RNC in Tampa to the DNC in Charlotte. And we were going to have white coats on it. We were going to stop along the way, and we were going to do like blood pressure screenings and talk to people about the ACA. And we announced this at our national leadership conference. And one of our members the next day left a message on our messaging, and he said, "This is the stupidest idea ever. Why are you putting resources toward these? I don't understand why you're doing it." Everyone got so excited about it. This guy took a week off from work and came on the bus and had like an amazing time. He was at all the stops, talking about the ACA, talking to reporters. We got tens of millions of media hits from it. not that we have to do something, not that we have to do a bus, or it just we just have to find something that enough people will get excited
Right.
about that you can make a difference, right? You don't need to have every single person in the alliance saying something in order to get money for data, money for whatever it is that we're saying that we need to get.
That's helpful. And when we think about though, when when it does come time to make the decision, I've been on teams or in campaigns in where could everyone mute for just a moment, please? I've been on campaigns in which sometimes you recognize that not everyone's at the table. Oftentimes, from my experience, the individuals that are not at the table often represent the vulnerable communities or populations, right? And so then you bring them in after the agenda has been set. But then when there are other decisions that have to be made, how do you navigate making those decisions and with regards to being respectful from the different perspectives, particularly the communities that we're trying to impact, those representatives maybe not having as much power technically. So how do you navigate those nuances, Matt?
Well, I think to me, it starts with outreach early, not just people who walk to the table. And that is, I think it's a clear recognition of who has a stake in the outcome or who should have a stake in the outcome, and making sure that there's a pathway for those voices at the formative stage. And, you know, having those conversations early on makes it a lot easier during a campaign where hard decisions have to be made. Because if everybody feels like they're being heard and valued from the beginning, then it's a lot easier to compromise on a strategy or tactic midway along the route. But I think it opens up with that. I also think there's another really important component to it, which is, as we're all thinking about what we're advocating for, you know, we need to do the research to understand exactly what the implications of those solutions are. And so that we need to understand what they are for every population we care about in advance before we go down that, so that we can be confident that everybody who should be at the table is going to benefit from the solutions and understands exactly the science and the data about that and can communicate it well.
That's helpful. So we're going to turn it over. We want to sort of pull in everyone for this discussion. So Alice and Matt, if you have questions for the audience, which I think you probably do, I'm going to invite you to lift up those questions for the participants rather, not necessarily the audience. But one of the things that I like to sort of set the stage with the Alliance, we have almost everything is a priority. And we've narrowed it down to a set of priorities, but it still feels overwhelming. So how do we, the Alliance as a body, start to make traction with regards to maybe even narrowing down our priorities even further? I think for me, it's a little bit easier to sort of see this done on a local level, but when you have national organizations with that all across the country that have their own priorities, how do we work as a group to begin to narrow it down so we can start to execute? So I'm going to open it up to the audience. If there's anyone that would like to make a comment, please feel free to raise your hand and I will recognize you. You may also use the chat. But Alice or Matt, do you all have any reflections on the Alliance's priorities?
You know, I'd be the last to try to set the priorities, but from my perspective, we're facing a true existential threat to public health, the very core of the underpinning of it. And in addition to asking what our traditional priorities are, I think I would ask the question of what priorities would help us build support for the guts of what we want so that we can build out from it. So it may, you know, the actual outcome, the actual policy may be less important in priority setting this time around than what will begin to turn the arc of people understanding why they have to fund public health, why public health is in their direct interest, and what are the issues that would create that motivation and that energy going forward.
I totally agree. And kind of the question is like, what is winnable? Everything is a priority, but we unfortunately are not the masters of the universe, and we don't get to set all the sort of the agenda for the entire country. But thinking about what can we win? I mean, it could be something narrow that sort of opens up that wedge and gets things going, as Matt was saying. It could be something that's big. So it's a question for you all.
Yeah, thank you. I asked Angie to make it gallery view so we could all see each other for this discussion. Mary, did you want to give voice to your comment?
No, I believe that this is the question that we have to be addressing now in every setting that we're in. We have to lift up the science base of public health. We have to lift up the reason why data is important to continue to make available to the public. And I think continue to lift up different leaders that can relate to different populations, different communities. And we have to be more political. We have to speak out. I think Matt is one of the best examples of an effective public health leader in the political environment. So I wanted to +1 his comment.
Well, now that Matt is retired, maybe we can convince him to join the Alliance. But that being said, are there any organizations that we do not have as part of the Alliance that would be helpful for us to make sure we have a well-rounded appreciation of the challenges ahead of us?
When we were building support for giving FDA jurisdiction, we asked ourselves a lot of questions about who do people who are not our traditional allies listen to? So we created a coalition of religious leaders, for example. Not just religious leaders from their most progressive religions, but from a group of others who understood the message about protecting their children, their family unit, and the like with that. And that paid enormous dividends. And the key was the question of who else should care about this and what will it take to motivate them to care about it? So that we had some of the most conservative religious leaders in the nation looking at conservative members of Congress in the eye and saying to them, in a way we never would, this is a moral issue. But the key to it was we asked ourselves the question of how do we motivate folks who don't traditionally agree with us or who don't really care one way or the other, and who do they listen to, and how do we get them on board with regard to it?
I think that is spot on. In here in Tennessee, I'm in Nashville, Tennessee, and I know, Jacqueline, you're on the call as well, but it is very common for us to engage the faith community, the local leaders, just to, one, make sure that that accurate information is shared with the members of their congregations, but two, they do have a political presence, whether they want to or not. So that is a very influential voice. So making sure that we do have representation from the faith communities, I think that is something that we can add to our list. So thank you. Go ahead, Stephen.
This is a question for either Alice or Matt, but with all of your efforts, you've really had an emphasis on civic engagement. You're really approaching public health through civic engagement. And I'm wondering, how has that translated into political impact? And what did you do to help that happen?
Great question. I think you have to make it easier for people to have their voices be heard. Alice's bus event, I think, is both a fun and a clever one that can be replicated relatively cheaply with regard to those things. As leaders, it's our job to provide the tools, the information, and the opportunity for people to become engaged in the most effective ways. And that's a question that I think anybody engaged in a political activity always needs to be asking themselves. Alice's example, I didn't laugh at it at all. Immediately struck me as really smart. It'll energize people, it will get attention, it'll give you an opportunity to frame the issue, it will give people an opportunity to be involved in a way they think are effective and can be replicated. And I think, any political movement now needs to be constantly thinking about those kind of opportunities for doing it. Tobacco, wonderfully in many ways, is often thought of as a success, but the reality is we've never had 1 million people marching. So what we had to do is figure out how we took the people how we dramatically increased the number of people who would take an action, and figure out how to help them do it, and then figured out how to magnify that. And then through polling and other tools, communicate to politicians that that's what the public really wanted with regard to it. And I think, that's what an organization needs to be doing. It needs to be constantly asking out how it expands its base of support, how it gives people an opportunity to be the voice and be a voice. And once you've got them activated, then you've got them, if you keep communicating with them.
So this, go ahead, Alice.
I agree with all of that. And I think in sort of leading people to get involved and to do civic engagement, it is so crucial to sort of be a little bit ruthless in shutting down ideas that are just not going to move the ball. So many people say, I'll write a white paper and I have nowhere to publish it and I'm just going to write it and it will just be there. No, your member of Congress is thinking this. And they respond to church leaders, they respond to businesses or whoever, and therefore you need to mobilize those people with you. Go and tell the story about they have a daughter. Therefore, you talk about impact on girl. You have to help people sort of understand the strategy that is going to actually move the needle, both to actually move the needle and also so people will actually participate. So they feel like, okay, it's worth it. Why should I go talk to my, very left-leaning member of Congress? Because you want them to sponsor a bill, not because you want them to say public health is nice. So giving them kind of the tools to know what are they asking for and who are they asking and how are they asking can be very helpful.
So how do we as the Alliance, and this is open to everyone, so please, we need to hear, because this is, we're not just asking questions to get through the session, we're really asking questions and wrestling with what to do. How do we create and sustain a sense of urgency? So it was not this past December, but the last December, 2022, I believe, we had the Alliance meeting in DC, and there was a sense of urgency in the room. But once we left, I was wondering myself, how do we sustain that sense of urgency amongst this group of individuals? I was wondering if anyone had any thoughts. And there are we don't have the right answer. So we really are looking for ideas and thoughts that we can at least start to noodle on.
Can I suggest that this is a great place for brainstorming, but I think what one really needs to do is figure out, some of the issues that underline the things you all care about and test them out and which would motivate people. And can you bring people together around them? And incredibly important, it strikes me, is rather than all of us who probably agree about 99% of life, what phrasing, what wording can you test out that will motivate a broader range of people and will actually also activate the people who are already your supporters, but don't see you as this issue as their top priority?
I think that's really helpful. I know communication is one of our priorities, but I don't think that I had an appreciation for thinking about communication with regards to testing or piloting the message. So that's really helpful. Thank you.
I'd also offer, and my name's Kelly, and I'm with a colleague of Steve's that is working a lot on the alliance and building kind of support for collaboratives. And what I'm learning is that a network like the alliance or community collaboratives working to advance health and public health and health equity, there's an accountability and create that those networks can create and reinforce the sense of urgency for one another. And I think a lot of efforts are often very siloed, and in those kind of siloed lanes, we can define what feels urgent or not really pay attention to it because we can get kind of in the weeds on it. And I think when you bring in and you join and you're a part of a collaborative of some kind, there can be real dialogue and shared urgency that can be a bit more sustained and accountable, and then continuing to expand that kind of a collaborative can reinforce that. That's one observation I'd bring in.
Thank you, Kelly. Maureen, I just read your message in the chat. I'm wondering if you could maybe give voice to what that messaging process, the testing process was like for you all in Wisconsin.
Sure. Really backing up what Matt was saying, because they did test messages. And so then we knew what was most effective. So we started working on the local level with local smoke-free ordinances. And when communities really understood, which we tried to train them on, the message and what are the most effective messages, they did really well. And then we had communities that didn't either believe us or just felt like their community was in a different place, and they unfortunately did not succeed in their local ordinance campaigns. We found when you did the worker-based messaging, it brought almost everybody along. And the key piece is you don't need everyone to win. You know, you need the majority. And we had 38 local ordinances before we were able to get the statewide policy through. And most of those were decided by one vote. So it's a contentious process, but when you do have that tested message, it is much easier to know that you're moving in the right direction.
That's helpful. Thank you. So as a point of privilege, as the moderator, I get to pull into the conversation individuals that I know. So I'm going to pull in Scott. Scott, I'm wondering if you can maybe give your perspective, given that it's not just the messaging, but it's the messaging with the backdrop of misinformation and disinformation that we're wrestling with. So just what are your thoughts as we're having this conversation that come top of mind for you?
Oh, thanks, Tanae. And I'm looking over here at Bill Novelli, who I learned a lot from and knows more about both the message and the source. But I think what you're also saying, and thank you, Matt and Alice, for all the great work, and Tanae for bringing this together. So it's yes, it's message, yes, it's source, but it's also dosage. And I think the dosage or the ability for us to reinforce and get to the right audience at the right time in an ongoing way, with sort of Matt saying the movement side of it, is key. And frankly, we are drowned out by the misinformation and disinformation. I don't need to pass the baton to Bill, give his thinking on the Coalition for Trust in Health and Science. But as trust continues to get battered, for lack of a better term, at both the CDC, our health agencies. I think of the early part, what Angela was mentioning with Angie was mentioning about the House bill and all these other pieces. It's not just money; it's just the way we're reviewed. So, I think the piece that I think Matt said the strongest is, how do we get outside our public health silo? How do we get the right people, not only faith-based, but other organizations? And Tanae, I've been fortunate to work with you with Health Leads and the Children's Equity, Vaccine Equity Working Group. And I see Jacqueline on here with the new Health Equity Community Collaborative, and we're trying to get a new theme with this going on belonging. We're all part of health equity. We're all part of community. We think that's a a piece we can all rally around. So, you know, I just think we have to find these elements, and then as people have said with our Council for Quality Health Communication, which we're engaged, we have to take little victories right now. We can't just think that we, you know, need to win the big ones. All the incremental ones are important. So let's set our goals appropriately. And I think this group is super important to engage together and with our networks.
Thank you. Bill, I would love to hear from you, the expert, as well. I believe you're on mute. There you go.
Apologies. I wanted to say I really appreciated what Alice and Matt had to say. You know, the conversation, Tene, you asked a really terrific question at the beginning. What's the difference between a movement and a moment? And I think some work can go into defining those two things. Some of the things we talked about were short-term campaigns, and some of them were long-term movements. But when you listen to what Matt and Alice were talking about, and others have been talking about, one of the keys, I think, is that we have to operate at two levels. So most of what Matt was talking about was at the macro level, changing norms, changing public expectations. And the most important thing there, I think, is policy. And then others who spoke about community level work, that's the other level that we have to operate on simultaneously at, I'll call it the micro level, where we're dealing with communities and families and smaller units. And we've got to do both at the same time.
Now I need to unmute myself. So we have a couple of minutes, and I think that really gets to, that really sums it up nicely. Bill, I'm wondering if folks can talk about the grassroots. Is anyone on the call can sort of talk about grassroots efforts of pulling in the community to work with families? I do have some experience with that, but I really would love to hear from others on the call. What has worked in your local municipalities, whether or not it's with your 9-to-5 hat on, or it's the community work that you all do outside of your 9-to-5. What have you observed? This is a quiet group. Okay, well, I'll jump in and share.
I was gonna say,
There
Anne,
we go,
go ahead.
Anne. Okay, it's flipping back and forth. I didn't see you. Please go ahead, Anne.
Hi, good afternoon, everyone. So Anne Reed, I'm with the GW Funders Forum on Accountable Health. So we're a group of philanthropic funders that are very interested in multi-sector community-driven partnerships, and their efforts numbering over 150 across the country, rooted in the Accountable Health Communities demonstration project at CMMI. So I would just put out there that one of the key features of this model is the community engagement, along with public health, healthcare, social services, and other sectors. And so fundamentally, we've seen examples where there's work happening to address individual level health-related social needs, but also really trying to get at systems level change that's going to address the underlying drivers. And that could include policy changes, whether we're talking about housing policy changes, whether we're talking about environmental health policy changes. So just to put out that as a framework in terms of where we've seen this work well.
Thank you, Anne. And I'm reminded as when you're talking about systems level changes and of course policy changes, a lot of times that in the local states that happens from the rank and file individuals trying to push it through. And those families and those communities are also impacted by those system inequities. So it really is making sure that we come full circle. I will offer this as we begin to wrap up, that I think we have great representation at the table. I think we can also make room for grassroots voices. And if you are wearing a grassroots voice hat also, you just haven't raised your hand, I think that would be helpful for the Alliance to know what type of expertise that we have in this group. I want to say thank you to Alice and Matt for having this conversation. I think this is a conversation that we will have to continue, but I do believe from, at least from my notes, and I've seen others, Angie and others taking notes, that we have some nuggets that are new to us that we can start to peel back those layers and think most intentionally about. I think the one that really sticks with me though is to make sure that we have the appropriate messaging for the appropriate group. So we have to get out there and start testing that message, because there's nothing that we're going to be able to do if we can't communicate it out to our stakeholders, regardless if they're elected officials or if they're the grandmother next door. So I want to say thank you to everyone. And Angie, I'll turn it over to you if there are any last minute words.
No, that's it. Just thank you so much, Dan. I think you wrapped it up really well, and we really appreciate Matt and Alice and all of you who joined in for this panel. I think it's been a really great presentation, and as you said, I think a lot of nuggets to build on, and we'll share the recording and also some of those discussion points over the months to come. So thank you all, and we'll see you in August. Have a great
Thank
rest
you.
of July.